Hi, welcome everybody. Thank you for joining us during this presentation about the Master Population Health Management. My name is Sabine. I'm currently a second year student of the Master program and I have a background in clinical medicine. And I'm here today with Manon and Mark Bruinseels. Manon, maybe you can start with introducing yourself.
Yes, I'm Manon. I'm a first year student at the PHM Master, and before this Master I did a Bachelor in Psychobiology at the University of Amsterdam.
Thank you. And of course, we're also here with Mark Bruinseels.
Good afternoon. My name is Mark Bruinseels, and I'm the program director of this Masters.
Perfect. So the three of us are going to guide you through this presentation. And in this presentation, we're going to cover what population health management is and why it is important. After that section, we'll have some room for questions. And then we'll go on with the program structure and the practical information about this program. And of course, Manon and I will share some of our own experiences so you have an idea of what it's like studying this master. And at the end, we'll have some more room for questions and more information. So please, during the presentations, if you have any questions, just leave them in the chat box. If you see a question you like, give it a like so that we know that it's an important question that we want to cover. And during this presentation, we'll cover them live with you. So the first section will go about what population health management is and why it is important. Mark, you are the former of this master program, so maybe you can tell the students, the potential students at home, what population health management is and why it is important.
Oh, thank you, Sabine. I'm really glad that you're all here, and I want to tell you a little bit more about the background of population health management. And if we start with population health management, the first thing we have to do is to define the term population health management. And it is about managing the health of a population. And in that sense, it is a unique master's because it covers the whole health arena of a population. And how do we ensure and make it more healthy for that population? So that's what population health management is all about. It's not a new paradigm, but it's a revival. This paradigm is in the last 5 to 10 years becoming more and more important. And why is that so? Because we face some challenges within healthcare. And the challenges we face in healthcare are several. For example, resources are running out. We're running out of money, we're running out of personnel, we have a changing epidemiology, so there's more multimorbidity, people have more problems at the same time instead of only a single disease. We have, unfortunately, organized everything in healthcare into silos. So we have everything specific for a hospital, specific for general practice, specific for municipalities, and then we have the health insurers or the payers or the government, and everything is organized in silos, and every silo has its own governance structure. So it's a challenge to get everything connected because, especially because of the multimorbidity, people are getting more and more complex needs, and that needs another organizational structure. And finally, we see a lot of technological improvements which makes much more possible, but also much more possible in the home situation, and that people can take care of the health themselves. So we face a lot of challenges that ask for something different. Yes, please. And different also in a way that we don't want to have a one-size-fits-all healthcare anymore. We see that health problems are in the population unequally distributed. Like you see in this picture, you see we have tall guys, medium guys and small guys, and they all want to look over the fence to that baseball game. That's the same in healthcare. What does a guy over there needs to get a glance of the game that he wants to look at? Then you see that the small one needs more than the tall one. So a one-size-fits-all is not really that healthcare should provide, we think, from population health management. We think that different needs require different solutions in different populations. So it's much more a targeted approach towards a population and to their needs. And not only the needs in a medical way, but we see that in the paradigm shift we are facing in this current era, that we also want to look at health in a more holistic way. People are becoming more in the center and not their health problem or their disease. So we are looking at much more in a holistic view, and as the slide says, we are going from sickness and cure to health and behavior. We are not only looking at repairing what went wrong previously, but we want to prevent that it won't go wrong in the future. That's the way we look into population health management. And to do that, next one please, and to do that, you see that population health management needs much information, much knowledge, much applications from different disciplines. So we made an interdisciplinary master. It has interdisciplinary features. It is a proactive approach. We manage the health of a population. We need for that data analysis. You've seen in these days that there's a lot of big data going on. Every day in the newspaper there are talks about data. So we are going to use that data for getting more health in the population. And how are we going to do that? So it's a data-driven approach. But it's not only about big data and quantitative data, it's also what matters to the patient. What matters to you? It's also about qualitative data. So we try to combine those within those analyses. To think about solutions, we are not only thinking about solutions coming from our own mind and our own perspective, but we really like to do that in co-creation with community and providers. So co-creating and learning how to co-create with the community, with the providers, and with them both is also one part of this masters. And of course, you need the right prerequisites, you need the right financial incentives. We know that money steers behavior, so it matters how we reimburse in our healthcare to get what kind of behavior. For all that, you can't do it alone. You can't do it only out of the hospital, or you can't do it only out of a community, or you can't do it only out of a municipality. You need to do that in an integrated supportive governance infrastructure. So that's what we built within this master based on these interdisciplinary features. And why did we do that? In the next one, please. Because we really like that people from this masters contribute to the necessary change towards a sustainable and integrated health care system. And I want to put care between brackets because it's really about an integrated health system. Well, Sabine and Manon, what do you think about this? If you hear this, you chose to study this master's a couple of years ago, or a couple of months ago, I must say for you, and you 2 years ago. And then, why did you do that? What did it is? Well, tell me.
Yeah, for me, my bachelor was really focused on problems and how you can treat symptoms. And I was really missing the broad overview of health. So I really like data analysis, but also health behavior and governance. And in this master, everything comes together. So I really like the different point of views you get during the masters.
Yeah, and I totally agree with what Manon says. I was studying medicine, but at one point I was like, I want to focus more on how to improve the chances of health in the population and not only cure someone that's sick. And I was really interested in looking into different aspects within the healthcare, not only the governance or how to organize a hospital, for example, but really look into different aspects of healthcare to make sure that in the future I could work in a field that focuses more on health instead of just what Mark said, curing diseases, so more on the health in total, not just healthcare. So I was really enthusiastic about this master, and this was exactly what I wanted at that time. And now that I'm in my second year, I have to say that everything Mark just said, the first time I heard about governance and data and health behavior, I was like, okay, interesting. I have no idea what you're talking about. But now I'm a year further, so I want to say that if you're at home and you're hearing terms like governance and you're like, I don't know, I now know what he's talking about, and I'm now really familiar. So this program really helps to gather those insights. And now that I'm in my second year, the next question I get from people is, where are you going to work when you're done with this program? And I'm quite sure that people at home are listening and are thinking the same. Where can I go after this master? Where can I work? And Mark, maybe you can tell them where people can work if they follow this master's program.
Well, thank you, Sabine. And I think we can. What did we do when we built this master a couple of years ago? We went to the workforce and we asked all the potential employers, what kind of people are you looking for that you think you will need in the future organization of healthcare? And then they come up with several personas or persons that they thought they would need, and they are listed on the slide. So they asked for academic strategic partners for various stakeholders. That means that they wanted to have people that could, on the one hand, understand the interests of an organization or of a professional or of a patient or of the payer, and that they can build upon those different perspectives as an academic broker, and for decision makers being that academic strategic partner, so that they can really steer healthcare in the next future, in the next century. Furthermore, they saw already that there was a lot of data being present within healthcare, and even more was coming. And we do not really know how to use that in a proper way that in the end patients and peoples and communities benefit from it. So they wanted to have data specialists that steer the behavior of the community and the professionals in the end to reach more health and a better health care. And because it's a complex system, they said, and we are only sitting in our own organization or in our own perspective, we need people that can see the whole complexity of a transformation that we need, but also know how to deal with that complexity and how to deal then with that transformation. So they asked also for people with implementation skills, and not only for their own organization, but as they look into the future, they saw that you needed networks of organizations where health and healthcare will be delivered in the future. So that's what employers ask for. Well, is that the kind of an answer?
Well, it gives an idea,
Oh.
but maybe there are also some concrete examples of where you can work.
We prepared that one. We knew that one was coming. So yeah, there are, and these are two advertisements of vacancies that we found recently, and you see those are. One is based from a company in the Netherlands, Philips, and they ask for people who are responsible for the commercial success of the data and digital transformation in healthcare to control costs while improving patient care. You see, there's a lot in that first sentence, and I hope you get a glance of what Philips is asking then, and we are training people for that kind of job. The second one, which is in the US, is even more closer to population health, because it's even in the title, population health manager they ask for. Those are people that are really hands-on within healthcare organizations, between healthcare organizations, improving through quality processes, targeted with a data-driven approach to patients, really trying to get health and healthcare better. So these are career examples for leaders of the future. And we see, and this slide shows that it is a growing market worldwide. It is maybe not so familiar yet in mainland Europe and in the Netherlands, but if you look at the UK and the US, it is growing quite rapidly in the NHS and in the accountable care organizations in the US, but also in India. They are looking at population health management in a way. In developing countries, they are looking at population health management because we are our point of departure are the needs of the population and not the organizational and the institutional structure which is there. So we see a growth in market. Well, that was an answer.
Yeah, that was quite an answer. So now we had the first part of the presentation about what population health management is and why it is important. And we're now going to answer some of the questions. And one of the first questions is whether there are many international students in the program. Manon, how is that in your year?
Yes, I think around 40% is international students. And I think it's also really helpful because you learn a lot from health systems in different countries and works there. So I think it's also really helpful to have international students there.
Yeah. And in my year, I think we also had about 30%, maybe 40% of the students was international. And they were all it was really international. So we had someone from South Africa, someone from Syria, we had someone from Croatia, China even. I don't know how that is in your year.
Yes, I think a lot of people from Europe, what you said, also China, I think Greece, Lebanon. It's really all over the world, international students.
Yeah. And also during the program, there are a lot of international examples. So it's not only about the Dutch healthcare system and what's happening in the Netherlands. Like Mark said, it's something that's growing worldwide. So you also have a lot of examples from the international prospect. And the next question is, what is the difference with public health? Mark, I think you can give a good answer for this question.
I think both of you should give an answer on that question already, because it is in the first course. We really emphasize the differences between public health and clinical epidemiology and population health management. And you see what the difference with public health is that public health is focusing on the community, whereas population health is also focusing what happens within healthcare. So we cover the whole range from not having any disease yet until you end up at the emergency or at
emergency department.
Emergency department, or even at I'm getting old. I'm losing track of my work. At the intensive care units. So also over there in those departments within specialist care, you can apply and execute population health management. And population health management is in that meaning more an approach and a paradigm shift of way of looking and approaching health problems, whereas public health is more one of the domains where we want to execute. So it aligns with each other. It complements.
Yeah. Okay, now we'll go on with the second part of the presentation. If you have any questions about this part or even the first part, feel free to ask them, and then at the end we'll have another round of questions where we can answer some of the questions. So the second part of the presentation will go about the program structure and some practical information. And of course, Manon and I will also share some of our experiences. So Mark, you just told us a lot about what population health management is and why it is important, but how does that look like in the program? How did you build the master program on this information?
Okay, we started with 4 pillars coming from 4 different disciplines, and these are the social sciences, data sciences, medicine and governance. And students, you have encountered those, and you see different faculty coming from different disciplines teaching within our master's program. So in that sense, it's really an interdisciplinary program. So we started from these 4 pillars, and based on that, we came up with the next curriculum. And within the curriculum, you see that we made a shift from monodisciplinary first half year to an interdisciplinary second half year to a more individual, free-formed second year. And if you see if you look at the labels of the different courses, you start with some kind of introduction of fundamentals, but then you have rather monodisciplinary courses to get everybody on the same level, regardless of their own discipline. And then we enter in the second half year, and you look at the labels of alternative payment models, which is of course about financing, which you look at syndemics, which is about medical and social determinants combined with each other on the progression of health and diseases. We have predictive analytics, which is more data-driven, but then, again, much more focused on the clinical part as well. And then to implementation courses, panel management, which is more implementation at the clinical level, and putting population health management into action is more at the community level. So you see that we try to build, coming from different disciplines, an interdisciplinary program. And then in your second year, which is a free format program, which means that you can choose. You can choose based on your own interests, in your own knowledge and competences, where you want to accelerate later on. Then you can choose, and it's those labels are only directions. They're not fixed. You can make combinations of those labels. You can choose your own direction and make your own program. It should be, in a way, interdisciplinary. But that gives you a lot of room. Well, Manon, you've done it now for a couple of months. What did you think about it?
Well, I really like the first course because it really, the name says it's fundamental, so you really know what it's important in the field. And I just finished study design, and I think that was my favorite course because I also like data. And I noticed that during these few months, I really liked the structure of the program. So that was something I did not have before. And so the structure is that there are 10 courses in the first year, and they all are 4 weeks long. In the first 2 weeks, it's all online education, so it's a lot of self-study. You get knowledge knips, which gives a lot of information in about 10 minutes. And then you do literature and reading for yourself. And there are also a lot of assignments to see if you really understood all the information that was given to you. And I was kind of afraid during these weeks that you're going to be alone a lot. But I noticed in the first few months that a lot of people from my year study together in these weeks. And also the teachers are very reachable for us. So there are consultation hours during the week, and in which we can ask questions to the teachers. But also at other moments, we can also email the teachers, and they respond pretty quickly. So that's really nice. And then the third week is on campus. So it's on the campus in The Hague. And it's an intensive group week where mandatory presence. So it's 9 to 5, Monday to Friday. And you really learn to have the knowledge that you learned in the first 2 weeks and apply it to a real life problem. So you work with a group on a project, and then you spend the whole week together finishing the project. So it's really intensive, but it's also a lot of fun to do. And then in the fourth week is also an individual week, and then is the final assignment. And in these assignments, it's a lot of freedom what you want to choose for subject. So that's also very nice to really focus on what you find interesting about the course. And also then there's a lot of consultation hours, and you can ask the teachers if you have any questions. So I think that's very nice.
And maybe I can ask you, if you talk about teachers and having contacts and interaction with them. How are they?
Well, I think they're really nice, first of all, in the on-campus week.
Good to hear.
That's good to hear. And in the on-campus week, you also really get to know them because it's really intensive. So you don't only get to know your group really well, but also the teachers. And there's also a lot of the teachers have practical experience. So, for example, some teachers are general practitioners in The Hague, and they really can help with giving practical examples for questions you have. So that's also really helpful to have.
Yeah, and if I can add to that, because of the contact with the teachers during the on-campus week, choosing something for your second year becomes a lot easier, because I think almost everyone in my year found their internship or their program by talking to the teachers, by getting to know their contacts. So I think that makes it very personal, and it really brings you further. So it really helps that it's such a close group, so a small group with such intense interaction with the teachers. It's not only someone telling you on a screen the information, but it's actually working together on the project as well. Yeah.
And maybe I can ask you, if you look at the online weeks, both online weeks, we come out of a situation of COVID that everybody experienced what online education meant during COVID. Is it similar? Is it different? What do you think, Manon?
I think it's really different than the situation in COVID, because then you just had a 2-hour lecture and that was it for the lessons. And now it's really more about short lectures and understanding the materials, and also doing assignments and group assignments to really comprehend the stuff that was taught in the knowledge clips. So I think it's a big difference with COVID teaching and this kind of online education.
Yeah.
And is it more nice or is it bad or?
I really like it because it's really flexible, so you can make your own schedule and how things you want to do things. But it's also you can still work together, so you can study together at the campus in The Hague, and so it's not really lonely. You spend a lot of time together, even in the online weeks.
Yeah, and I also think the short knowledge clips, they're maximum of 10, maybe 15 minutes, so that's enough to keep your attention on what is being said, and then afterwards you have the assignments and what Manon said, the literature, to gain further knowledge on the subject. So I also thought it was really different than what you may know as online education by the corona situation, where it was just sitting behind a screen and listening and absorbing and not doing anything. Here you actually have to work with the information you get. So it's a lot more doable to spend 2 weeks online behind your screen.
And Sabine, if you look at you're now in the beginning of your second year, you're doing your internship right now. If you look back at the first year, what did you think? Was it if you have to give it a grade or something or an expression, what comes into your mind?
Well, grade, I'm not sure, because I was in the first year of the master, so there were some logistical issues that we did encounter, and I think that's part of being the first group. So things that they hadn't thought of, or links not working, but also orientation weeks that were actually too late in the year, so it was actually not helpful to find what you wanted to do because you already had to have your plan. But what I really liked is that the feedback we gave was, I had the idea it was listened to. I also know that the structure this year is different, so the orientation weeks are now earlier in the year. But overall, if I want to say something about the master program, I think what's really nice, it's a really broad program, so you get a lot of different angles of the healthcare. And I do feel like because it's just 4 weeks on one subject, you really, at the end of the 4 weeks, feel like, oh, I've learned something, even though 4 weeks is quite a small period of time. But because every course comes back to the same things, and at the end you kind of feel like courses blend together, so the teacher also help you, like you had this during health and health behavior, for example. So in the end, it goes by really fast, but in the end you gather so much information and so much knowledge, which is really nice. And I think because there's a lot of group work, that may sometimes be frustrating because you have to work with people a lot. But it also really helps to learn more about working together, working with different perspectives, and going towards an insight together.
Oh, it sounds like real life.
Yeah.
Okay.
And also, I want to say, because that's what I really like, the on-campus weeks, the projects you do really help to use the information you learned during the online weeks to really put it into practice. And I found those weeks the most, I learned the most during those weeks, talking together about subjects, challenging your own ideas, but also putting it into practice. For example, we had you haven't done that course yet, but for alternative payment models, we actually had health insurers coming by, giving us a case that they were struggling with, and together we had to think of an alternative payment model for that problem. And I found that really, really fun.
Yeah, and I think they did too, because your solutions were even better than they thought of. So
exactly,
that was quite nice. And what about you, Manon? If you look at, because you also are running now a project case, and what do you think about that?
So the project case is 1 semester each, so there are 2 in the first year. And so you get an assignment during every month, and then you have a group, and then you choose a real-life problem, and just do the assignment based on the real-life problem. And I think it's really helpful because, first of all, you can use the knowledge you get from the courses and apply that to a real-life problem. But also it's really nice to do a longer project than just 4 weeks and really see it come together. So we're in the third month now, and I feel like we just really get a project now. So that's really nice to see.
And that also makes me happy because in my year, the project case one wasn't a great success.
We shouldn't say that.
So I'm really happy that your project case now is running smoothly and that you're learning a lot from it. So I think that's enough on the structure. People at home may be wondering, is this master for me? Who can admit? Who are we looking for?
Okay, yeah. Well, if you listen to the fellow students over here, you'll hear it. They are curious. They are innovation oriented. They have an open mind. Those people are really what we are looking for. You know, we want people that have a broad perspective. They want to have a broad perspective and want to encounter and develop new skills in other areas that they are not so familiar with yet. We want to be people be active. It's your curriculum. You have to study. We know it already. I always say what is being taught. So we try to get you as active as possible, but that also requires something from you. So we look people who are really want to be active. International orientation is said enough about already. You study in a close collaboration with the professional field, like the general practitioner that's already there in the first courses, or in the second year where you really are going into internships outside of this building, outside of the university, and you are going into the work field, working with the professional field. We ask you to have some kind of background in medicine because we really like you to be able to talk with doctors and nurses and understand their way of thinking, because we are talking health and healthcare, so we are talking diseases as well. So that's really why we want to have people who know that area. You don't have to have studied medicine or something like that, but you need to have had some idea of how does it work in a body, and how do doctors and nurses think and treat you. You need to have affinity with organizational questions and issues. So it is about healthcare organization. And we like people who are not afraid of quantitative methods. So if you don't have sufficient skills yet, it's not a problem, but you should not be afraid of quantitative methods and methodology and statistics and big data sets, and want to search in those, because that's really part of population health management, next to the qualitative part. Of course, it's not an only quantitative methodology part, it's also about qualitative methodology. Those people are we looking for, and we translate it in some bachelors that have direct admission, and some bachelors that we really want you to come if you have sufficient pre-knowledge, and a lot of bachelors have, but you have to show it a little bit. So direct admissions are for people who study medicine, biomedical sciences, clinical technology, biopharmaceutical sciences, pharmacy, human nutrition, health sciences, veterinary, health and society, and European public health and stuff like that. So a little bit in the healthcare and the health and in the medical domain. Also, that's where we would like people coming from, direct admission. We also like people from other studies, but they have to show a little bit more about their sufficient knowledge of medicine and quantitative methodology methods. So about 12 EC, we like to have that you show equivalence of 12 EC on each domain that you have being taught with that. Well, and then the most boring part, there are, of course, application deadlines. They are important because otherwise you are too late. But if you don't need a visa or a residence permit and you want to start in February 2023, please hurry up, because the deadline is November 15 of this year. That's 1 week from now. If you want to start in September 2023 and you are coming from far away, outside of the European community, then you need a visa or a residence permit. So sign up before April 1st, 2023. And if you do not need that, so you're coming from the EU, for example, then your deadline will be May 15, 2023. Well, that's being said. All those details, but that's the boring stuff, but important. And now back to the more important stuff, to your fellow students. Manon, can you tell us a little bit? You've studied it now for 3 months. What are you saying on a birthday party if they ask you, how is it?
Yeah, so I'm really enthusiastic about this master's, but I will say in the beginning, the first few weeks, it was a little bit overwhelming. because it was a structure that I was not used to, and you have a lot of assignments and deadlines that you have to reach. So it can feel like a lot, but I feel like now I'm in the third month, and now I'm really getting the hang of it, and it becomes a lot easier to do all the assignments and do all the group work. So that's really nice to see that you get used to something so fast. And would also say, after the first 2 weeks, sometimes I really doubted, do I know enough to do this on-campus week? Do I know enough to do this project? But I feel like in the on-campus week, everything came together for me. And so even if you don't understand something entirely, in the on-campus week, it becomes so clear. And it's really nice to be able to spend a whole week with the group and the teachers. So the group, it exists of a lot of different bachelor backgrounds. So you can also learn a lot, not only from teachers, but also from each other, because you have so different experiences already in a bachelor. So that's really nice. And also the atmosphere in the group is really nice because you get to know each other so fast. So even if every on-campus week we go to have drinks with each other. So that's also, you really have a group that you become close with and can all do all the courses with. So that's, I really like that.
Oh, great to hear, great to hear. But then the more experienced one, Sabine, what do you tell now these days on the birthday party?
Well, what I tell now on a birthday party is that I'm currently doing an internship. I totally agree with what Manon is saying about the first year. I had the same experience of it being very overwhelming at first, but in the end, you get used to the structure, you get used to the deadlines. It does get a little bit less with the deadlines, but it gets better. Now in my second year, I actually miss the on-campus weeks a lot. I miss the drinks at the end of the week, but we still have a lot of contact with the different students. I chose to do an internship for my first 30 ECTs in the governance track. And by talking to a lot of teachers and professors, I came towards Q Consult, which is a consultancy firm in the healthcare sector. And I'm working on the project of HealthKick, which is an organization in the Netherlands that is helping regions to implement population health management, what is needed for to be able to implement population health management on the financial side, but also governance side, but also the practical side, like do you have the data, what data do you need? And for me, at first, I had to really get used to working because I'm doing a 40-hour week. So working and also getting the hang of population health management in practice, because you're working in a field where population health management is new for a lot of people. So even being an intern, I'm also kind of the expert on population health management, which is quite a weird role to have. But now, 3 months in, I'm really enjoying it. I'm learning a lot. I'm also really seeing a lot of information that I gathered during the first year come back into practice and make me think about it again, like that was taught, but how does it actually work and what knowledge am I missing? And I'm really happy to actually experience what population health management looks like if you want to do it in practice, and meeting a lot of people. I'm meeting a lot of people in the healthcare field, which is a lot of fun. So yeah, I'm very enthusiastic.
Great to hear, great to hear. And Manon, do you have any idea where you want to go after this year?
I think this changes after every course, but now I would say I really like epidemiology and I also like governance. So I think I want to combine those two, but maybe after governance track, I say no, that's not for me, but we'll see.
Yeah, we'll see. Because what you said it, you miss now the group, because the group from the first year, they spread out. Can you say where some of the students went to, spread out?
Well, we have some people internationally. So we have someone in Suriname, someone in Boston, the USA. We also have a lot of people in the Netherlands still, but then at very different internship places. But also some are doing courses in the data section. So yeah, everyone's all over the place.
Yeah.
But we're starting with two weekly meetups to see everyone. So I'm really excited to see how everyone's doing and how their experience is for the second year.
Okay, thanks.
So now we'll have some time to answer some of the questions. And the first one is a bridging program pre-master required if you have finished a HBO health study? HBO.
That depends. Depends on what kind of HBO you've done. So If you have sufficient background within medicine and quantitative methodology, and especially for HBO, the last part, the quantitative methodology, is an issue. So you maybe need some bridging program if you have already had a lot of sufficient health courses and health information, health knowledge. So for people from physiotherapy or nursing or midwifery and stuff like that, it's all possible. But then you have to apply, and we have a look with you what you need.
Yeah, and you can also contact the master program. If you go to the site, you'll find the details for the email address, but also the study advisor. And she can help you to see if you require a pre-master or something like that. The next question is, how many students are enrolled in this master approximately? I think there are two ways to answer this. In my year, there were 20 people.
In I think my year 28, I would say.
But I don't think there's a maximum.
No, there's not.
So if you want to apply, you can apply. Does the program require high level of knowledge in math and statistics?
I would say I had a lot of statistics in my bachelor, and in courses like study design, it comes back a lot. So for me, those courses are maybe a little easier for someone that hasn't done this. But the guidance from the teachers is really good. So even if you haven't done it, you get the knowledge quite fast. And there's a lot of assignments and help throughout the whole year. So even if you don't have the background, if you're really motivated to learn it, I think it's really possible to do the masters.
Yes, I agree. I don't think you need a high level, just some level of math and statistics or knowing what it is. But you really get guided through the courses. Do the final assignments and projects at the end of the course mean that there are no typical exams?
I would say for the courses I had till now, I don't know about the rest of the year, but for the course I had until now, there weren't really typical exams. It was mostly writing essays or those kind of things, just really focus on writing and applying the knowledge you learned from first few weeks in an essay, basically. So I don't know about the other courses. No,
there are no typical exams. So that was really refreshing for me. You do have the knowledge test at the end of the online weeks, but so far it's only required to do so, and it's something to show you where your knowledge is lacking, possibly, but not that you get a grade for the knowledge test. And other than that, it's just the assignments, like you said, essays. And that's also nice because then you can choose your own direction. So if you're really interested in, for example, the youth care, then you can focus assignments towards that topic. Is it possible to combine this master with a job? Did you work, or are you working?
Yeah, so I work 1 or 2 days per week, depends on the week. So in the on-campus week, I usually work 1 day. And I think especially in the first 2 weeks, it's really doable because it's really flexible schedule. But I think it's around 35, 40 hours per week that you have to be studying. So it is allowed to have a job next to it, but it's also really possible if you're motivated to do it.
Yeah, the only thing I think that you need to keep in mind is that during the on-campus weeks, you have to be there. It's mandatory, and there are days of 9 till 5 p.m. So if you do work, you also need to be a little bit flexible with when you work. But especially during the online weeks and the final assignment week, there is an option to work, but you have to be very flexible with your own schedule and make sure that you have enough time to do the work for the online weeks as well. Is a medical degree sufficient to for entry to PHM? Mark.
To be honest, I don't know what you mean with this medical degree, but if you have done a bachelor in medicine, then that's sufficient. That's sufficient. Yeah. So if that's the answer, and otherwise you have to make it a little bit more explainable what you mean with a medical degree.
Yeah, so maybe also contact the master program so they can have a look at what degree you actually have, and also if you need any pre-masters or if you're directly admissible. What are the options to study or do an internship abroad? So like I just said, there are a few of the fellow students that are abroad. Both are doing an internship. One is doing more research-based, qualitative research, and the other is doing more quantitative research. If you want to go abroad, make sure that you have an idea of where you want to go and what you want to do, so you can start in time in the year, because especially for studying, there are some deadlines internationally that you have to keep in mind. So if you do want to go abroad, let everyone know, let the teachers know, let the study advisor know, so they can help with figuring out where you can go. But like I said, the teachers you meet have a really broad network. So if you want to go somewhere and you have an idea, there is a big chance that they know somewhere in the country doing kind of what you want. So make use of that network. And do you have more examples of how students are filling in their second year? I'll answer that as well. There's some people like I said, are doing data courses. I think at the LUMC, but I'm not sure.
No, in Scotland as well.
Oh, in Scotland as well. There are also some people doing more epidemiological courses, also here still in the Netherlands. I know someone that's doing an internship at the RIVM. Also someone doing an internship at the hospital here in The Hague. And the people that are doing courses now, I know that they're also trying to go abroad, maybe for their research proposal at the end. And probably also Scotland. So there are a lot of options, and it's quite broad where you can go in the second year.
Yeah, maybe I can add a little bit on that one. You see that, for example, the people who went to the epidemiology department over here at the university are combining that all together with their research thesis that they have to write at the end. So that's one big whole year program that they come up with. And somebody else went to, for example, she went to Boston, and she's doing a qualitative study, I must say, but more an advice. It's not really research that she's doing over there for the Massachusetts General Hospital. And then in the second year she comes back to the Netherlands, and then she starts her research thesis being supervised over here in the Netherlands, again on youth care, but then based on the data set and then on a quantitative data set. And she's going to do a quantitative analysis of. And another one went to Australia, and she's combining it with both things as well. She's doing some kind of example research or study on the regional healthcare organization around north of Sydney. I forgot the county where she is now doing it. But then she's coming back, and she's going to write a scientific paper, more based on literature and experiences here in the Netherlands as well. So you see, there are different ways of fulfilling your second year.
Yes. Well, I think we covered a lot of information. I can imagine that maybe you still have questions about the program, about the structure, about our experience, or maybe someone else's experience. If you still have questions, you can chat with me by going to the website. You'll see my face pop up. If you click on that, then you'll go to the chat, and you can ask anything you'd like. I'll give a very honest answer. And if you want to speak to someone else, I can also help you make a contact with someone else. Also, we would like to ask you to join our Experience Day. We hope you're really enthusiastic about this presentation. If you join us on the Friday the 16th, you'll get a better idea of what population health management is if you study it. So we hope you all sign up, and we'll see you there. But also visit the website for more information, also for the contact details, also about maybe application requirements. So that was it for the presentation. Thank you very much for joining us, and we hope to see you Friday the 16th, and otherwise we hope that you'll sign up for the Masters next year. Thank you.
Bye-bye.